Hello, I'm Michael Ross. I'm a physician who lives at Newbridge on the Charles in the independent living community.
And I'm Benita, his wife. Together, we've been asked by Hebrew Senior Life to discuss what we as residents can do to support their efforts to maintain a healthy campus in the midst of the coronavirus pandemic.
What we'll discuss in the next few minutes are three major points. The first is I'm going to provide some basic information about the pandemic, about coronavirus, how it's transmitted. And then after that, we'll talk about the goals for all of the Hebrew Senior Life communities as we move toward what I guess we have to refer to as a new normal. And then the last item that I want us to cover are the specifics of safety, how we can protect ourselves, how we can each contribute to protecting our community. In terms of the pandemic, we've heard a lot in the news. I'm sure we've all read about other facilities, nursing facilities, other facilities for seniors have been the primary source for the most cases of COVID-19, for the most severe illness, and for the most deaths. And so that immediately puts us at some concern here at Hebrew Senior Life. But there are two other factors that we should keep in mind. One is that in China, in Europe, and in North America, and really around the world, age is a very significant factor for increased risk for serious illness or death. The other factor that plays in is that what I refer to as comorbidities, things like obesity, cancer, heart disease, diabetes, have all been associated with increased risk. Here in our age group, most people have one or more of these factors, and this just puts us at increased risk. So how is the coronavirus spread? The primary means for spreading the coronavirus is as an aerosol. An aerosol are the fine droplets that come out in our breath as we talk, as we walk, as we breathe. These come out very rapidly. They cover relatively short distances, perhaps up to 6 feet. Somebody else comes along, breathes in that aerosol. They will never realize they've done it, but they are inhaling, breathing in virus. And that in turn can infect them and lead to illness or death. Two more factors are important when we think about aerosol transmission. The first of these are what we call asymptomatic carriers. Not everybody will ever get sick from coronavirus. Many people are infected with it and do not develop symptoms, do not realize they're sick, but they do have the virus in them. They do exhale it in an aerosol, and they can infect others who in turn do get sick. These are what we call asymptomatic carriers. The other factor that we also need to keep in mind in this regard is the incubation period with the virus. I can be infected with the virus, anyone can be infected with the virus and not have symptoms for a period of up to 2 weeks, 14 days, and then become sick. But the important thing is that during that 2-week period before they become symptomatic, they may also excrete the virus, exhale the virus in an aerosol. And as such, they pose a risk to those around them. How do we control the disease? There is no treatment yet for COVID-19, and there also is no vaccine which guarantees immunity or which can really significantly protect us. There is research going on both of these fronts. Hopefully, in the not too distant future, we'll have both treatment for those who do get sick, and we'll have a vaccine to prevent us from getting sick. But that's not available now, so we need other methods to protect ourselves, to be cautious, as has already been done and is being done. We talk a lot about testing for coronavirus. There are two types of tests, neither one of which is perfect, both of which have problems, both of which are not totally reliable and do not allow us to change our behavior. We still need to be careful. One of these tests for virus. putting a swab into the nose, or perhaps eventually taking a sample of saliva where they can actually test for the virus itself in a laboratory. This is being done. It's useful, it's helpful, it can monitor the health of a community, but it only gives a single point in time. And the fact that somebody such as me does not have the virus today does not mean that I don't have it tomorrow. It does not guarantee anything for a week from now. Testing for antibodies is another part of this that we also are working on from a research perspective. If we know somebody has antibodies, we need to know that those antibodies, the body's natural immune response, can protect them. We're not there yet, and so we cannot, even if you have antibodies, you can't be sure that you won't get infected in the future. The other element that is very important in limiting the spread of the infection within the community is contact tracing. This is ongoing here in Massachusetts. We have what's called the Massachusetts Contact Tracing Collaborative. If we have somebody who comes down with the virus, we know they do, the Contact Tracing Collaborative reaches out to all the people that person has come in contact with and puts them in quarantine, prevents them from furthering the spread out into the community. Hopefully, none of us will be in a position of having come in contact, but if we hear from the Massachusetts Contact Tracing Collaborative, we need to cooperate with them, identify who we are, who we've been in contact with, so that we can limit the spread within the communities. I'm now going to turn it over to Benita, who's going to give you a sense of the goals as we move toward a new normal.
Hebrew Senior Life has three major goals. The first is to limit the entry of the virus into the community. The second goal is to limit the spread of the virus if it gets into the community. And the third goal is to maintain the vitality and well-being of our community. So it's important to understand the best infection control practices and to appreciate the delicate balance between the coronavirus risk and the essential need to establish a new normal. Hebrew Senior Life follows the Massachusetts and the CDC guidelines for reducing risk and loosening restrictions. We understand that those guidelines include an attentiveness as seniors and to realize that the best place for us basically is to be at home. And we're instructed to be careful that currently our best option is to stay away from others and to only go out for essential errands. We are safest at home. And then we need to appreciate that we are responsible not only for our own safety, but the safety of our community. Inherently, the very fact that we live here establishes a social contract where we have agreed to be part of a community that is attentive to ourselves and our own well-being and that of our community at large.
Hebrew Senior Life has put in place a number of changes in our lifestyle. I think we're all familiar with those. We'd like to think that these can immediately end. They can't. We need to continue them. We'd like to know what the roadmap is. We can't know what that roadmap is. There is an element of uncertainty. We need to adjust going forward based on new data, based on what we learned from the governor, based on what we learned from the CDC. It is an incremental approach based on a best judgment as we go from day to day. I'd like to now have our conversation move to the three major areas that we can focus on, that we do to protect ourselves. We're going to talk about the social distancing, we will talk about masks, and we will talk about hand washing. Benita?
First slide, please. Well, you can see these guys didn't quite get it right. Not all of them anyway. 3 of the penguins are much too close, where one is looking back and I think saying, hey guys, we need to have 6 feet of distance between us. Next slide. And here you can see 2 that are together and the third one looking over and saying, you know, that's really not 6 feet. We need to kind of rethink that. So what does social distancing mean? Go back to the picture. We know that we've been advised that it's 6 feet apart, and that's given as a distance that basically protects you from the aerosolized spray that can come out when someone is speaking and whatever. And therefore, we try to keep 6 feet apart. But it's not just the 6 feet apart. It's also being aware that we want to stay out of large groups of people that particularly might aggregate in smaller groups. When you're sitting around and you're enjoying each other's company, there's a tendency to kind of aggregate closer together. And we want to be aware of the time we spend in close proximity to others, because the virus is more intense when you are potentially exposed to it over a longer period of time.
The next element that I'd like to talk about that is equally important are the masks. Can I have the first slide there, please? As I said at the beginning, coronavirus is primarily contagious through an aerosol. And we put on masks as a way to protect ourselves and to protect others around us. And using a mask is not perfect, but it can help. It can reduce the risks associated with this. And there are several key steps associated with a mask. The first of these is the proper wearing of the mask. And these slides that I'm going to show you are all taken from the World Health Organization, but I think they illustrate this very well. The first of these says that we need to be careful to cover both our mouth and nose with the mask and make sure that there are no gaps between your face and the mask. Next. Once the mask is on, it's really important to avoid touching the mask while you're using it. As I said, you're breathing in air that other people have breathed. That means there may be virus on the surface of this. So you want to avoid touching the mask while using it. If you do touch it accidentally, you need to clean your hands carefully. This can be done with an alcohol-based hand rub or with soap and water. Next. It's equally important to be careful when you take the mask off. You know, it's not just simply taking it off, it's the fact that there may be virus on the mask and you don't want to infect yourself at the end of having been careful for many hours. So to remove the mask, remove it from behind, remove the straps around your ear and go forward. If this is a paper mask, discard it immediately in a closed bin. Again, cleaning your hands, washing your hands, and we'll come back to that in a minute, with alcohol-based hand rub, soap, or water. Having done that, replace the mask with a new one as soon as it is damp. Do not reuse single-use masks. Let's just go back to face. The next element that I want to talk about is hand washing. As we talked about masks, about the fact that you can get the virus off the mask onto your hands. Now let's take a look, as we'll see in the next slide, about how we should wash our hands to make sure that we do this effectively. Here we go. First of all, wet your hands and apply soap. Lather the entire hands, the front, the back, the top, in between the fingers, around the nails. And then scrub your hands for 30 seconds. How long is 30 seconds? Sing happy birthday twice. Now you may sing.
Happy birthday to you. Happy birthday to me. Happy birthday, happy birthday, happy birthday to us. Happy birthday to you. Happy birthday to me. Happy birthday, happy birthday, happy birthday to us.
And if you survive listening to us sing, you can then, or survive listening to yourself sing, you rinse your hands off thoroughly, dry your hands with a clean towel, or if you don't have a clean towel, just let them air dry. Don't wipe your hands on a dirty surface. So, with all of that in mind, the slides are off now. Where are we? Hebrew Senior Life, Newbridge on the Charles, all of the communities within Hebrew Senior Life are working toward a new normal, incrementally, for ourselves and for our community. We're doing this in a variety of ways. This has been a major disruption, and yet at the same time, we've done well so far, and we want to continue to do well, even as we try and restore some of the social aspects of our communities and try and regain our mental equilibrium. Key elements, I'm just going to restate them one more time. Social distancing, keep 6 feet apart. When you're near people, particularly for any length of time, when you're in that 6 foot range, wear a mask, wear it properly, and wash your hands. Wash your hands every time you think about it. Every time you put a mask on or off, every time you come in contact with a surface. And last, cooperate, abide by the rules, and work with the Massachusetts Collaborative for contact tracing. That's really important for protecting our community as a whole.
Stay safe, stay healthy. Thank you.